Hi, my name is Caitlin Morris. I'm a sophomore in the College of Public Health, and I have been working as a contact tracer since September of this year. So just kind of an overview of what we've been doing. In response to the COVID-19 crisis, my internship position as a contact tracer became an essential part in tracking down and stopping the spread of the virus. The goal of our position within the disease investigation team was to contact members of the community to distribute health guidance and to collect information on the wide range of symptoms and long-lasting effects of COVID-19. So everyone knows what COVID-19 is, but just to preface the introduction. COVID-19 is a global health crisis that has caused the infection of over 55.6 million people and the death of over 1.34 million people worldwide. As an unprecedented global pandemic in our times, this is something that every public health official has been working on for months in order to bring an end to the spread of the virus. The mission of Johnson County Public Health is to resolve issues related to public health, to offer the public resources and services, and act as a liaison to the public in order to resolve issues. Specifically, at this point in time, our main priority is COVID-19. So just to start off with a project description, our main purpose as a team was to streamline the complicated process of informing cases all the way to collecting data on COVID-19 when the case has been resolved. The Johnson County Public Health Department is the main receiver of a very large portion of the cases of the entire state of Iowa. So our responsibility over all this information was taken very seriously, and they expected us all to act in a professional capacity while at work. As a team, our mission was to contact cases, find who they have been in contact with, and to connect with individuals as best we can in order to offer them health guidance. So we have different steps in order to complete a case investigation, and it would start with first contacts. So this involves reaching out to individuals who have tested positive and to simultaneously ensure that they can take the time to give us more information about their condition later on. Then we would move on to case investigation. So that would involve asking about a case's symptoms, previous medical history, the health of other members in their household, and who the individual had been in contact with recently. Then contact tracing was next, and this would take up a large chunk of our time. And this is the part that involved in interviewing an individual who had come in contact with someone who was tested positive. Oftentimes, this individual had no idea that they could have been sick, so it takes a level of professionality in order to ensure that they understand the importance of their quarantining on a wider public health scale. Then this would end with data entry, where we would put all the different symptoms and just different pieces of data into a singular database that is accessed by health professionals, as well as we also would have our data sent directly to the CDC for their data reports on COVID-19. So some challenges we would face: we were expected to maintain confidentiality at all times, which occasionally became difficult when parents would ask questions about their child who has been in contact with an individual who has tested positive, or someone would refuse to quarantine because it was impossible for them to have come in contact with anyone who has been positive. But we had a mission to follow, and we would follow through with it to the best of our abilities while keeping that confidentiality. So now moving on to my personal assessment. This was a one-of-a-kind experience that there's really nothing that could have prepared me for entering into this type of position. This has been like a huge learning curve in order to learn how this process works and what information everyone needs to get and how to conduct myself as a professional in this environment. I would say that unless I had worked a job in customer service, mixed with every public health class that I've really taken so far, that would really be best to kind of describe what this type of job is. As a significant personal accomplishment, this has allowed me to hone my personal relation skills in order to best relate to and speak with others, especially in a situation when they're stressed and are looking to me for answers. I've also learned more about what the process of public health personnel are signing up for as a career, as I've kind of gotten a peek behind that curtain. So now moving on to conclusions and future impact. As someone who hopes to eventually enter a career in public health, this has been a unique opportunity to engage with professionals in the field, as well as assist in combating an unprecedented public health crisis. I now know how it feels to have someone thank you for your patience and help after they ask you a stream of questions about COVID-19. it makes me feel that I have definitely helped them in a way that no one else could have helped them at this point in time. Overall, I think this experience has made my goals more realistic as a public health professional. It's easier to imagine working in a public health department since I see one in person more often, and I've seen the different professionals that I interact with there on the daily. I would definitely like to continue in this position past just the end of the semester. And since COVID-19 is an ongoing crisis, I would say that they're definitely keeping us around as long as it is an ongoing crisis. I think that over time, I have definitely become more efficient at my job and have been able to contribute more to the department as a result. So I just want to end with acknowledgements just to thank you to Jake, Amelia, and Jennifer from the Johnson County Public Health Department. They've definitely taken us all in and gave us a wonderful experience as contact tracers working there. So thank you all for listening.